The following Ardelyx podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hi, everyone. Welcome back to the Gut Matters podcast. I'm your host, Johanna Ruddy. I'm Senior Director of Patient Advocacy at Ardelyx, and I'm joined today by my co-host, Dr. Andrea Shin, a practicing gastroenterologist out of UCLA. As usual, we're talking about something that affects millions, but often gets only whispered about in our doctor's offices, and that is irritable bowel syndrome with constipation. We've talked a lot in previous episodes about how for many patients, this journey can be a lonely one. It's filled with misunderstandings, trial and error diets, and the physical toll of a body that just won't cooperate sometimes. So our guests today are trying to change that narrative, and I'm so excited to welcome our two guests, Ruthie and Jessica. They are the powerhouses behind the Belly Bestie Club, and that is a community that they have built where TMI doesn't exist and where peer support is just as vital as clinical care. So we're going to get an inside look at the Belly Bestie Club and also an insider's look at a new app that Ruthie is developing called Tuut. And it's designed specifically to help IBS patients turn their symptoms into actionable data. So Ruthie and Jessica, welcome to the show.
Thank you.
Thank you so much for having us.
We are so excited to have you. I have been talking about Belly Bestie Club since, when I was first introduced to your concept like in the fall of 25. And then got to experience it myself in person in December, which was amazing. And so I just keep singing your praises all over the community of IBS about what a great thing you've developed. But I'd love for you to share with our listeners a little bit about yourselves and your unique backgrounds, because you do have really unique and different backgrounds that then somehow came together. So Jessica and Ruthie, please tell us a little bit more about yourselves.
Sure. So I am a registered dietitian. I got my start from the very beginning. I was put on Miralax at 12 years old, eventually diagnosed with IBS at one point, then went to become a nutrition major at Cornell University, was put on the path to becoming a registered dietitian from there, and did not know that I would go into GI health at that point in time. I first did my training at Northwell, and then I went on to work in hospital in inpatient care. And on the side, I started doing GI nutrition, and it was because I was actually diagnosed with celiac disease my senior year of college. So they gave me at first the diagnosis of IBS and then the diagnosis of celiac disease. And I was really excited about helping others with celiac disease. And then all of a sudden I started getting referrals for IBS. And I remember the first time someone asked me to help them with the low FODMAP diet, and I didn't know what the low FODMAP diet was yet. And I really taught myself through other providers' education and was able to help others with IBS, and then really focused my time in GI nutrition, and then eventually went on to go work at Columbia University Celiac Disease Center full-time and focused on those patients and any outside patients as well that have GI conditions, mostly celiac disease and IBS. So that is kind of where I got my start with all of this, and that's a bit of where Ruthie and I intersected.
Yes. So I have a very different background from Jessica. I actually started my college career as a nursing student. So I always had this idea that I really wanted to help other people and be working very intimately with other people in some capacity. But I quickly pivoted and took a little bit to find my footing. I was working in marketing while dealing with IBS and celiac disease. I was first diagnosed with an autoimmune liver condition when I was 6, and with that came a whole host of digestive health conditions. And I was formally diagnosed with IBS when I was in high school, and then later celiac. And after graduating from college, I was working in marketing and started to experience a really severe IBS flare up. And that is when someone recommended that I reach out to Jessica to start seeing her as my dietitian, which was the best decision I ever made, because that's why we're here today. That's how I met Jessica. And really, when I started to talk to her about this app I came up with, which is now called Tuut, to really help people experiencing IBS, built from my own experience with the care gap in my own medical care, I was talking to Jessica about how important community is for the app, because as someone with IBS, I often feel very isolated. And Jessica had told me about this idea for a supper club to bring people together to talk about different digestive health topics, educate people who might not be seeing a GI doctor or a dietitian on a regular basis. And I immediately fell in love with the idea. I said, this is my dream situation, my dream night out. If I came across this myself, I would sign up for every single dinner on the spot. Let's make this happen. So from there, we just kind of made it happen, which is really crazy. Lots more to discuss there, but that's how we crossed paths.
Well, thank you both for being here. I'm really interested in kind of learning more about, your journey, and then also this community that you guys have created. Taking us to this, the Belly Bestie Club, I think my first question that, I would have, maybe Ruthie, you can start by answering it, and you kind of led into this already, but why is a community model so essential for a condition like IBS, especially, a condition that can feel very isolating and embarrassing for a lot of people who live with it?
I could answer this question all day long for hours on end. I think community is integral to treating IBS. As Johanna kind of alluded to earlier, a lot of these topics are considered taboo or TMI. They're topics that even people with IBS who deal with these things on a daily basis have difficulty discussing with other people. And that can make it feel very isolating dealing with this condition, because you're not supposed to talk about certain things that then feel really lonely when you're dealing with this on a daily basis, and it's directly interfering with your social life, your work life, but there's not really an outlet for you to openly discuss it and feel seen and validated. So I think creating this community, Belly Bestie Club, where we welcome people of all dietary restrictions, of all digestive health challenges, and say, look, we are here to support you. We see you. We know what you're experiencing is very real. It's not just stress. It's not just a tummy ache. This is a very real thing, and we're here to build a community to help you get through that, has been honestly just as healing for me as it is for the other people attending, because I am also dealing with these challenges on a daily basis, and the connections we make in a short dinner, because we're talking about these really intimate topics, is so much deeper than you just going to a random dinner party where you're meeting other people. So it's a really special space, and I think showing people that they are not alone and that they can get through this with the help of amazing providers like Jessica, who has been helping me get through this, is really special and important.
And I would just add to that, this idea for me came about because I always think of my different patients who would really benefit from meeting each other, but because of HIPAA and privacy, I don't have a way that I can just tell them about each other. And so this became an outlet for introducing people to each other who would have shared shared connections and be able to really benefit from knowing each other. And then the other side of it is that a lot of people don't know what they don't know. And they might not know their symptoms to be IBS, or they experience abdominal pain or bloating or constipation or diarrhea, but nobody told them to seek out professional help from a gastroenterologist or a GI dietitian. And so I think the conversations that come up in these dinners really help to open the eyes of our attendees in terms of what is normal, what questions should they be asking, what tools can they be using to improve their quality of life.
I can imagine that there are an incredible number of people out there who would really love to have the opportunity to connect on issues like that, questions like that, especially when they don't know who to go to. Just to get that information out there, can you tell me a little bit more about the operational flow of your club or how it works? People who are interested, what could they do to become members, or what are the resources that they might expect? And I think you've kind of hinted at this a little bit already.
All of our dinner events are open to anyone. It's open to any. We found that people with IBS, people with celiac disease, providers, people in the nutrition space, people in the wellness space, or just partners, allies, anyone has been really interested in attending, and anyone who's just interested in digestive health. So basically what we do, we have a website on Tuut's website, and we advertise the events that we have. We sell tickets. The best way to hear about our events is through our mailing list. So you can join the mailing list. The link is on our website. We do post a lot on social media at Belly Bestie Club, and we try to share different things from the events in terms of the educational points that were discussed. We also like to share a lot of that in our newsletter as well. And this is for the community. So we are looking to make each dinner helpful and valuable for our community in terms of what topics, what expert speakers we have, what types of products to introduce to our participants. So we've had such amazing dinners. The Backed Up Babes in December was such a special dinner to talk about constipation. We just finished our Valentine's dinner, Dating with Dietary Restrictions, and we have just so much more planned for the future.
Wow, that's really incredible to think about all of the resources and information and the support system that you've created for people out there. Just out of curiosity, and maybe Ruthie, you can elaborate on this. Do you have any, for example, personal stories that you'd like to share about how finding, the Besties Club actually, changed outcomes for individual people, either from, a health standpoint or even mental health? And I'm sure it's already had a lot of impact already for people.
Yeah, sorry to interrupt. It's actually so funny because when Jessica and I started this, we were like, a dinner once a month. How hard can it be? This is going to be great. It's so fun. It's so easy. It is very challenging to plan all of these events, and I think takes 10 times the amount of time either Jessica or I anticipated. But truly, the comments that we get from everyone following the event makes all of it worth it. And we send out feedback forms after every event. But I think we make the vibe so open and dynamic at the event that people feel very comfortable coming up to us during the event or on their way out, or even following up with us on Instagram after. And people have consistently said that this is a space they have been looking for and yearning for and just had never found, and that they are so excited for and grateful for this community, which truly has meant the absolute world to us. And I think specifically, all of our attendees, we had been sending out feedback for every event, and we follow up with them asking for more and more feedback, but they all report increased quality of life, feeling much more comfortable advocating for their own digestive health after learning from Jessica or our other featured speakers and besties. So to know that they're coming to find community, but also leave feeling more empowered and having much more education and knowledge around the topics we discuss is really amazing. And it's really such a privilege to be able to create this space for everyone.
It's such a cool concept, and I was so privileged to be able to experience it firsthand. And you're right, the sense of camaraderie and comfort in that room amongst everyone. And I mean, the ladies that were there when I attended, most of them, that was their first time coming to the dinner. They were newbies. They had seen it on social media. They didn't know anybody else there, with a few exceptions. And the women that I spoke with were like, yeah, I just saw it and I really wanted to learn more about why I'm having the symptoms I'm having. And so here I am. I just thought that was so incredible. And they were like, I'm coming back. Like, I've learned so much. And I feel like this is a place that gets me and gets what I'm going through. So it was a really, really great experience. So I want to switch gears a little bit, Ruthie, and ask you about Tuut. First of all, super creative name. And for our listeners, it's spelled Tuut, so Tuut. So, as a patient, Ruthie, you mentioned with IBS and celiac, what was that missing piece that you saw was existing in the current trackers for symptoms that are currently available? And what was the impetus that made you go, nope, I can do better?
Great question, and something I've obviously thought a lot about. So I would say for me, and this has kind of been a pattern throughout my journey, it really felt like what was missing was the patient's experience at the center of all of it. So there are several incredible tracking apps out there, but every one that I tried felt curated solely to the clinician and super data heavy, rather antiquated. The UI was a little archaic. It was not a place that I wanted to spend my time. And it also took a very long time to track on them. So it kind of begs the question, should I just do this manually if I want to be spending less time on my phone anyway? So I had come up with the idea for an app to essentially make it a lot easier for patients to track this data and fit seamlessly into their busy life, because I know how much of a burden it can be to keep a manual food diary and track all of this information. It also can encourage hypervigilance and lead to other negative behaviors that I'm acutely aware of. And furthermore, I know this is already a burden people are dealing with. So when I set out to create a tool that would be easier for people, I also wanted it to be a tool where people enjoyed spending their time. So I wanted it to be bright and vibrant and fun and personable and very contained. So another thing that I experienced on some of the other apps I'd used was an overwhelming amount of data collection that felt, okay, I can't do all of this, so I'm just going to leave the app instead of maybe logging one thing. So I've worked super closely with Jessica and with other providers like Kate Scarlatta to capture just the right amount of data to really get the best insights possible without overwhelming the user. So really putting the patient at the front of the app has been my main goal, and that's relatively easy, dare I say, as someone who experiences these challenges myself, because I'm truly building the app that I need on a daily basis. But I would say the other side of that is also making the app as useful for clinicians as it is for patients. So the other apps were really just helping one side of the coin, and I'm really working on building a solution that helps both. And I am very adamant that this tool is to be used in collaboration with medical providers and dietitians, GI doctors, not instead of. So I think putting the patient experience first and foremost, and then also making sure it's equally effective for clinicians as it is for patients as well, is providing that missing link.
Yeah, that's great. I love that. So, I mean, I think you're right. Too much data can be overwhelming for patients, and sometimes data that's collected isn't all that relevant to the provider either. It's like, yeah, okay, that was great, but sorry you spent all that time tracking. I don't really need that to make a good treatment decision or whatever the case may be. And so I'm curious, how does this app then kind of help the patient prepare for their appointment with somebody like Dr. Shin? What kind of information would a patient be inputting that then Dr. Shin can look at and be like, I see what's going on here. This is a clear picture of what's driving your symptoms.
Yes. So another important factor to mention is that Tuut takes a holistic approach, because as we know with IBS, it is not just diet, it's the interaction of so many things. So Tuut captures your symptoms on a sliding scale on an ongoing basis. It takes seconds to report those. You can capture your food and drink intake via photo or voice memo. It captures stress on that same 0 to 10 sliding scale, your sleep, your exercise, which you can also just sync with Apple Health instead of manually entering, and your bowel movement data. So it collects all of this data in a very digestible format. So again, instead of overwhelming the user, it's a set number of questions rather than just like a blank box where a user has to enter a bunch of notes. So I worked with providers on deciding what those questions and metrics should be. And then the user can have all of that data in one place and go to their provider and walk into the office feeling much more empowered, instead of having a food diary in their hands with notes from all different days where maybe they took more notes or less notes, and it's kind of all over the place and hard to follow for both the patient and the provider. They have everything organized, consistently formatted, and easily accessible, and they have real data to point to. One of my qualms with the food diary was I would finish tracking and then say, okay, now what? And the whole point of Tuut is it turns like that now what into here's what's next, because it does provide you with insights by, showing you your patterns. AI syndicates your data. I worked very closely with Jessica on clinically informed algorithms to syndicate the data. And then the user can take those insights to their provider and say, okay, based on the data I've entered, here is what's surfacing. What do you think about this? What can we do next? And have a collaborative conversation rather than entering the room kind of questioning how many times they felt bloated in the past few months. And I'm actually working super closely with providers to format a PDF even that the user can export to send to their healthcare provider. That includes just the right amount of information for the provider as well, because we know our providers are very busy. So again, making sure the provider doesn't have information overload just as much as the user.
That's really great, Andrea. I'm just thinking about, we've talked a lot in the past on episodes about how patients can better advocate for themselves when they visit their gastroenterologist. And one thing that we've said is to keep track of symptoms, keep track of both physical symptoms as well as emotional and quality of life data pieces that might help drive decision making around treatment changes and things like that. I'm just curious from your perspective, how awesome would it be to have data from a patient that comes to see you that's actionable as opposed to just kind of like haphazard?
Yeah, and we've kind of touched on this, point about communication between the patient and provider being such a key component in terms of, coming up with an effective treatment strategy. And being able to use technology to improve clarity of communication, I think, is an incredibly valuable way to use the tools available to us. I think it's very easy for patients to be overwhelmed by the symptoms and the experiences that they're going through day to day, it's very hard for people to know what's important to track, what's not important to track.
Yes.
And sometimes that leaves them in the position of, well, I need to share everything because I'm not sure what's important. So having some of that guidance and, having a tool that can make communication more effective between a patient and their provider, I think would be wonderful. I think over time, when you have long-term relationships with, a trusted clinician and a patient, then, the communication figures itself out. But especially in those early stages, that's really tough. It's really challenging. So, I'm just really encouraged to hear about this and to learn about it. And thank you guys for building something like that.
And I think those insights are going to be a game changer, because I recommend symptom journals all the time. And then patients will often come back with 30 pages of data of what they ate and what they drank and their symptoms. But really, the thing that I'm looking for out of that is the pattern. And that's what I'm trying to help Ruthie. And she's been just doing an incredible job of providing insights that will show a pattern, and not to give advice on what to do next, but to give that insight to your provider so that they can recommend the best course of action for your next steps. So instead of seeing 100 different meals that they have eaten, which are the meals that actually produced bloating or abdominal pain or diarrhea? That will be such a game changer for us in terms of the time that we have and the recommendations that we can give that are actually effective.
Well, thank you, for sharing some of the insights for that. I think I'm just really excited to hear about this. I think, moving on to another point of discussion, just talking about this connection between the community that you've built as well as the technology. I'd love to learn a little bit more about that. Jessica, can you maybe elaborate on how the Belly Bestie Club and this app Tuut can actually work together, or how users use them together? Are they, two separate components, or do people usually combine them? And if you could share a little bit more about that, that would be great.
Yeah, and I'll let Ruthie speak to this a little bit more, but basically they both kind of came from the same idea. Ruthie had this app idea, I had this dinner club idea, and then we used both of these ideas. Originally, Tuut was called Belly Bestie. Now it's renamed to the amazing Tuut, and Belly Bestie Club has retained Belly Bestie. So we are promoting them together, and I think that once Tuut becomes available, this will be a really valuable tool for many of the people who attend these dinners, and it will help identify what their triggers and their symptoms are, so that when they come to a dinner, they might choose one that best suits them. So part of the people who come now is really learning about all of the things out there, but we will have each dinner be very specific to the topics that we want to address. And so someone who really realizes that IBS is their diagnosis, they might attend our April dinner for IBS. Or if they recognize that GERD is their symptom, then maybe they're going to attend a GERD specific Belly Bestie Club dinner. And I'll let Ruthie talk more about the intersection of the two.
Yes, totally agree with everything Jessica said. I think also, which I have said so many times now, but I really can't emphasize it enough, the importance of community in dealing with any digestive health struggles. So when I called Jessica to tell her about the app, and originally the app was actually going to have a community forum of sorts on it, but Belly Bestie Club is essentially that community just in real life. I think it is so important to be able to provide an experience for people where they can meet others experiencing similar struggles, specifically when it comes to IBS. It really can feel very isolating, and in my own care journey, I haven't always seen the right providers, and they questioned my symptoms and the causes of my symptoms. And that was really invalidating to me. And also, not having anyone close to me in my life who experienced these issues on a daily basis also made me start to question things. Is it just me? Am I exaggerating? Is this truly something that deserves medical treatment? Is this something I should just suck up and not talk about because no one else is talking about it? So being able to show people that there are so many others who experience this, and you should not stop until you find the right provider for you and the right care plan for you, is so important to Tuut, because it is really a holistic approach. It's not just technology. It might not even, Tuut might not even be the tool that solves it for you, but it is really important to find that tool, and community will definitely help with that.
And Tuut will highlight the fact that you should work with GI dietitians and gastroenterologists, and Belly Bestie Club will also highlight these expert speakers that we have. And so I do feel that a lot of our guests and people, users of Tuut, will find providers that really work for them through both of these avenues.
Yeah, it sounds like having, a dedicated tool like Tuut can actually strengthen some of these conversations within the community. And I do love the fact that, you have this technology, but you've also got this in-person, real person component to what you're doing, which I think is, oftentimes, rushed, and we don't have enough of that in, our current day life. So yeah, thank you both for doing that.
And beyond just the community, they're also able to enjoy food among others, and we kind of take a lot of the work out of it for them and help to make a really great dinner in New York City be tailored to their dietary restrictions and provide them with a meal. Ruthie and I are foodies, so we are making sure that all the meals are delicious and that they are tailored. And again, they're not the only person who can't eat garlic and onion at the table, or the only person who can't eat dairy at the table. And so that has been a really great experience for others to be able to enjoy the food that maybe they didn't necessarily know they could have before.
Right. That is amazing. Yeah, food is such a central component of social interaction. And I think sometimes we don't emphasize how much of that is lost for people with IBS who suffer from food-related symptoms. It's not just the direct physical effects of the food itself, but the impact that it has on their social life and their ability to connect and spend time with the people that they love. So I think that's a really thoughtful element of your club, and yeah, that's fantastic.
Yeah, it's also helped me a lot too, because my world got so small when I was really experiencing a severe IBS flare-up, and I got so scared to eat out in New York City. And as someone who loves food and loves socializing, having to cancel plans and not eat out felt really isolating. And then when I started working with Jessica, and she, showed me that there is a way to still enjoy food, enjoy socializing, eat out, and still honor your restrictions, it was a total game changer for me. So that's also like a very important aspect of Belly Bestie Club, is, to Jessica's point, showing people that no matter how many restrictions you have, you can come eat with us. You will have a delicious meal. We'll make sure you're taken care of, and you'll also build amazing connections with other people.
And the two of us have celiac disease, so all of the meals are gluten-free, and the celiac disease guests have just been so excited by that. And some of them, that's like their first time feeling okay going to a non-dedicated gluten-free restaurant. And so we've really seen their world open up.
Mm-hmm.
Such great stuff. So excited for both of you and for all the things that you're doing for patients to empower them, to provide resources and a sense of community and belonging. So we're getting close on time. If you have been nodding your head this entire episode, I want to leave our listeners with a roadmap. So first, when is Tuut going to be available, Ruthie?
Oh my goodness, the $1 million question. I wish I knew. Ideally, beginning of March. So keep your eyes peeled. I'm starting to really ramp up Tuut social media. So it's at the Tuut app. And we're submitting it to the App Store next week for review.
Awesome.
So wishing for a speedy review and approval process, and hope to be on an App Store near you very soon.
Perfect. That's great. So more to come. Follow along on social. So when you know, you'll find out when that is available. And if you live in New York City, you can find out about the next club dinner and sign up to attend. And if you're outside of New York, well, I'm trying to convince Ruthie and Jessica to franchise and branch out into other areas. So maybe get in touch with them about hosting your own Belly Bestie in your own town. I'm sure that would be a really fun thing to get your girlfriends together and have a conversation about digestive health over good food and good company. And if you're struggling with IBS-C, or a friend or family member is, you can send them this episode, because the more we talk about these conditions and the symptoms around them, the more we break the stigma that's attached to them. So Ruthie and Jessica, thank you so much for being here and for sharing all the amazing things that you're working on and helping turn a difficult journey for a lot of us into a movement of empowerment and innovation. Really appreciate you both.
Thank you both. It's been such an honor to be here with all of you, and I'm so excited to see what's to come next.
Absolutely.
Thank you so much. Thank you for bringing all of this to life and for spreading the word. We are just so excited about the potential of Belly Bestie Club.
Us too. Well, that is it for this episode of Gut Matters. We will see you again next time. Bye, everyone.